Finally here, the public health emergency sparked by the COVID pandemic is lifting.
But that may leave some parents and others with questions about how to handle the road ahead. So here with what is always helpful insight is Dr. Kristen Moffatt, infectious disease specialist at Boston Children's. Great to see you, Dr. Moffatt, and help us guide to this next level. So Dr. Moffatt, many people are certainly feeling relief that we've reached this point, but what do you say to parents who still might be a little more concerned about keeping everyone healthy?
Yeah, I hear those parents, and for some, this feels like a big shift. But I would really reassure those parents that we just know so much more than we did even 1 or 2 years ago about how to keep ourselves and our loved ones as safe as possible and as healthy as possible. We now have vaccines that are very effective at preventing severe COVID infection. We have medicines to treat people at risk for severe COVID infection. We know now that wearing a well-fitted mask, especially an N95 or a KN95, in environments where we might have increased risk of exposure to COVID-19 can keep us protected. And we have better public health systems and testing in place to alert us when community transmission levels of viral circulation are changing. So we have so much more in place to keep ourselves safe. And I just encourage and reassure parents to rely upon that.
So let's talk about that testing. During the pandemic, that was the norm. We were testing for COVID all the time, certainly kids in school. So the free tests are going away. What's your advice? When do we swab? When do we not? How do you know? What's the criteria in your mind?
Yeah, it's still tricky in that the overall recommendations in terms of what should prompt a swab have not really changed. So if someone has symptoms, including cough, congestion, fever, sore throat, those symptoms really should still prompt a COVID-19 test. But it can be taken into context and it can be more nuanced than that. For example, right now we're experiencing peak allergy season, and some of the COVID-19 symptoms, especially congestion and sore throat, overlap with allergies. So if it seems more like allergies for your child right now, if it's with watery or itchy eyes, or if it's a lot worse after they come in from outdoors, it probably is allergies, and you can avoid that swab. But if it's really looking more like it's associated with an upper respiratory infection, or if it's associated with a fever, those combinations of symptoms should still prompt testing.
Well, Dr. Moffatt, so it might not be fair to ask you to look into your crystal ball, but we are heading into the summer months. It's a much needed break for a lot of people. But can we ask you again to look into that crystal ball and tell us how you're thinking ahead to the fall? This is our first in years without a public health emergency.
It is, yes. It's impossible to know for sure, but I am very hopeful, especially based on the unbelievably high burden of respiratory viral transmission we experienced this past fall and winter, that we may have returned to our pre-pandemic sort of baseline level of population-based immunity to those viruses. So I am also hopeful that with that, we'll return to a much more predictable seasonality of virus circulation, and sort of we can rely more on what we used to be able to rely on for expected trends in when viruses might be circulating. So I do think that we need to stay up to date on information about when COVID vaccines should be offered again as boosters, or when viral transmission is changing in our community. But I do think that our return to school this fall will feel a lot more like a return to normal even than last fall. Certainly very different than 4 years ago.
I went to the doctor's today and I walked in and nobody had a mask on. And I talked to the nurse who was taking my blood pressure. It was a little high. And she said it was so nice to see other people's faces. So we're in a much different place.
Yeah, very different place and a big shift. And we've got a lot more tools in place to keep ourselves alert and prepared if things do change.
Great to see you, Dr. Moffatt. Thanks for your time.
And we still say stay well. All right.
Do stay well.